fear of litigation if they fail to prevent a suicide.
Yeah.
That's not a thing. Is that a thing?
Oh,
like, can you be sued?
Yes.
What?
That's like the number one reason why mental health professionals get sued is a patient commits suicide. That's the number one reason.
Who's suing them?
The family.
What? But that can't hold up. This is where I get frustrated.
Don't even open that can of worms.
Like horrifying.
Horrifying. Not allowed to cry or have emotions in your house.
Like, do you really need to know what Zymoglophicate is? Or
oh, Jessica.
Everyone has a favorite. Everyone does. Okay, so did you ever watch 13 Reasons Why?
I never watched it.
You never watched it?
I think I watched part of an episode, and then I was like, I just can't watch this whole thing.
Why?
I don't know. I think I was, I don't even remember. Maybe it was like where I was in life where I was just like, I can't watch like these teenagers just being aggravating.
Oh my God. Okay, well, I just started it. I think it came out like 2017 or something.
It was a while. No, I feel like longer than that.
Oh.
You think it was that recent?
Is it? I think
it was longer
they had
than
iPhones. How long is that?
No, that iPhones came out in like 2008. I feel like 13 Reasons Why is older than that. But maybe, I might be wrong.
Hold on. Now I got to look it up because it came out, 2017.
Oh, wow. Is that recent?
Yeah, I guess.
Okay. So I had like a
or maybe like the latest season was whatever.
Who cares? Yes. Okay,
we digress.
Continue.
Anyway, so I'm started watching them on season 2. Anyways, and like dark and like stormy it is. Anyways, and so so like self-harm just like has popped up on my caseload a little bit more recently.
Yep.
And just speaking with a couple of clients and like their previous experiences in hospitals and IOPs, intensive outpatient
program.
Thank you.
Yep.
And just like previous therapists.
Yeah.
Just like it was just jarring to me how like little work was done as it relates to self-harm. Like everything was like very Band-Aid. Like eat sour candy or go to a friend's house, like if you ever like have an urge to self-harm. All right. So self-harm and suicidal attempts aren't the same.
Correct. Not the same thing.
Yeah. Like are they not the same thing, or is it like not necessarily the same thing?
You can self-harm and not be attempting suicide.
But also, can you self-harm and be?
Correct.
Yeah.
Yes.
Okay. So So I'm going to go over just like some stuff. Like this is willy-nilly. We'll cite the source. Okay. So occurs when someone repeatedly harms themselves on purpose in a way that is impulsive and not intended to be lethal.
Right.
Not intended to be lethal. Higher risk of attempt. Obviously, people who self-harm are at higher risk of attempting suicide or like suicide by like what is it called? Like so like say I'm a cutter and like I cut so much and then I get staph and then I'm septic and I die.
Right.
Like what is that called?
I don't know what you call that. I don't know what the term is.
Yeah, but y'all get it.
Yeah,
anyways,
dying like a consequence of
yeah. Okay, so most common methods are skin cutting. This is interesting. I didn't know about this. Head banging and hitting.
Yep.
Oh, I'm going to ask you about that in a minute.
Yep.
Burning. And there are other forms, whatever. So prevalence, as what this little paper says, again, I will cite it. I don't even know if whatever. So this thing says 5% of adults in the U.S. self-injure. Wow. Is that a lot?
I feel like that's pretty high. 5%. But I don't know. It's probably accurate. It's probably accurate.
Who knows? Approximately 17% of teens reporting some form of self-injury. But the highest group is college students.
Really?
Rates ranging from 17 to 35%.
I'm surprised by that too.
Oh, you are?
Yeah. I thought it was going to be teenagers, like adolescents, like
younger
like
ones?
13 to 15 or something.
Oh, I don't. This is interesting.
That is interesting. Yeah. Huh.
I'm like, I buy it more anyway. So, okay. The potential reasons that people may self-harm, to distract themselves from negative feelings. I feel like that's, express emotions they may be embarrassed to show, develop a sense of control over their lives, process the way they are feeling, punish themselves for things they think they have done wrong. I would also add in here, like cathartic.
Yes. And you know what? The other thing I've had a lot of patients tell me is that they do it when they feel numb because it's like
they
want to
feel something. Yes, correct. Yeah. It's like like, what did I say? It's like a release.
Yeah. Yeah.
Like if you, like, you think about anxiety, right? Like, one of my professors called it this once, and I don't know why it resonated, but she called it like the pizza in your chest. Like it feels like you have a pizza in your chest. I don't know why.
Okay.
Like it doesn't, I don't know. And like I think about it, it's like you swallow food, but it didn't like go all the way down is like kind of how I think about it. But it can't get out. Like you can't like get
it's
that
trapped.
out.
Yes.
It's trapped. Exactly.
Yes.
Good word. So it's trapped. And so not that like everybody who self-harms is suffering from anxiety. It could be a multitude of things.
Right.
But all feelings are trapped.
Yes.
Like they're not like tactile.
Right.
Like it's like air, you know? And so it's kind of like a symbolism or a there's another word I thought of. Like whatever. But it's almost as if it's like when you cut or burn or self-injure, it's releasing whatever that feeling is, right?
Yep.
And anyways, so it makes sense to me.
Yeah.
No, I'm not telling people to go like self-harm.
No, nope, we're not endorsing it.
Not endorsing it, but it makes sense.
Yes.
Okay. So, okay, so it's very, like diagnosing it, it's usually a symptom of a mental illness, personality disorders, bipolar, depression, anxiety, OCD, psychotic disorders such as schizophrenia. Really?
I don't know if that's something that I see, but I guess it could happen.
Like I could see like whatever. Okay, so that's
trauma is another one.
Trauma, yes, trauma,
you know?
PTSD. I don't know why that's not on here. See, maybe this is not a reputable source. Okay, so intentional self-inflicted damage to the surface of the body with expectation of physical harm, but not suicidal intent. Seek relief from negative emotions, feelings, to resolve an interpersonal difficulty, to bring about positive feelings.
So this is what we now, like the term that we use now is non-suicidal self-injury. Non-suicidal self-injurious behavior is self-harm that is done not with the intent of killing yourself.
Yes.
Whereas like self-harm could be suicidal in some people. Does that make sense?
So what do they call that kind?
Like suicidal gesture. Okay.
A gesture?
Yeah.
Why not
or
attempt?
Suicidal behavior? Well, because I guess that's kind of gray, you know? Like if you are if you're cutting yourself, I don't want to tell people how to cut themselves the right way, but
also like
if you are cutting yourself in a certain way that is not actually going to
you're not gonna bleed out,
kill you, but you're having suicidal thoughts at the time, right?
Oh,
that's a little bit different than like you're just cutting yourself because you need to like release tension or because you feel numb, you know?
So it's like you. Okay, I understand. Yeah.
Yeah.
Okay. So. Okay. Self-harm. I feel like people, like we're like navigating like words and, what things mean, definitions.
Yeah.
And we're like providers and been in the game for a long time.
Yeah.
And I feel like now, like maybe within the past like couple of years, like self-harm has been maybe like less taboo or like people are less scared to address it in as it relates to clients or whatever, or like students, whatever. And I still think, especially like thinking about my caseload and like their experiences with previous institutions, et cetera, like providers, I don't know if it's like a lack of education or a fear of saying the wrong thing or this came up, fear. Okay, this is what I wanted to ask you about. Fear of litigation if they fail to prevent a suicide.
Yeah.
That's not a thing. Is that a thing?
Oh,
like, can you be sued?
Yes.
What?
That's like the number one reason why mental health professionals get sued is a patient commits suicide. That's the number one reason.
Who's suing them?
The family.
What? But that can't hold up. There's no fucking way.
It depends on where you live.
What do you go on?
Depends on where you live.
Go on.
So there's certain states and even like counties that are more are going to side more with the provider, and then there's certain states and even counties where they're going to side more with the plaintiff.
What? So wait, family sues me because a client was successful in a suicide attempt.
Right.
Okay. And I guess like what would be the argument as to why it's my fault?
So, I mean, it could be a lot of different things. Like what they would do is the family's attorney would subpoena records from you. Okay. And then they would dig through them and dissect them. And they would get an expert witness who's going to side with them to say like, oh, this provider failed to do X, Y, and Z.
Okay. What would be the X, Y, and Z?
I mean, failed to do a suicide screen for every appointment. Okay. Failed to notify whoever that the patient was suicidal. Failed to admit them to a hospital. You know, I mean, it's a lot of different things. And for doctors, it depends on where they are, what the outcome's going to be.
Okay. Get like here.
So here,
we're in Louisiana.
We're lucky in Louisiana that
they protect the doctors.
Yeah.
What about me? LPC.
I don't know. But like, for instance, okay, so I recently got my medical license in California.
Oh, yeah, I forgot.
And got malpractice to see patients in this very specific area of California, this like one county. Okay.
What county is it?
It's called Marin County.
Where is
Marin? It's outside of San Francisco.
Okay.
Okay. And they are very unfavorable to doctors there in that county. Okay. So like my malpractice insurer that I have for Louisiana would not cover me. And their like little subsidiary that is for telehealth, like they wouldn't cover me. And they were like, we won't cover that specific county in California because it's so unfavorable to physicians. And so I had to get like a different malpractice.
Holy shit.
I know.
Okay. So
sorry, we got off topic there.
No, we didn't. Fear of litigation. I mean, I think that's ridiculous. Anyways, okay.
It's ridiculous, but it's real.
It is real. And like you can do every screening, safety plan, and form. Like if someone wants to die, they're going to die.
Yep.
Like I don't, you know what I mean? Yeah. Anyways, I mean, I get it that they did this in 13 Reasons Why, but to the school. Anyways, other reasons why providers, like, I guess, address self-harm and maybe like inappropriate or unhelpful or like what's the word? I don't know. Like in some sort of like nervous ways, like how they feel. About it, you know, like their judgment, their perception, and so then they let their own feelings impact the way that they treat or talk to a person, right?
Yep.
Okay, so self-harm. We've already said it's self-soothing or it's, you know, whatever the rationale or reason or whatever, that's the purpose. So you have these, so like a couple on my caseload, it's like been in and out of hospitals, and this IOP had this therapist, and it's like the way that those providers were I can't think of words today. Were what's the word? Like confronting.
Oh, okay.
Confronting self-harm was like almost, I mean, I wasn't there, but it sounds to me, it's like Band-Aid. Like, eek! Okay, let's move, like, what can I say to move on to the next topic? Because I'm scared, you know?
Yeah.
And that is such a disservice.
Yeah.
Like, self-harm, okay? We've already defined it, kind of, whatever. It's like one of my clients was like, oh, it's, you know, I want to be more safe. This is unsafe. And I was like, I mean, like, is it unsafe? Like, tell me, you know, your routine, whatever.
Right.
And she wasn't, you know, they weren't suicidal. Like, verbally, you know, said not suicidal. Do it to, like, when I'm triggered or, like, when I'm in conflict and I feel like I'm going to explode, I need to release, like, everything we said. And so, like, their definition was it's unsafe but in reality, it's like, it's not unsafe. It's unhealthy. You can get like a bacterial infection or like whatever. It's harmful. It's not helpful.
Right.
You know?
Right.
You have scars. Like, it's not great. Like, it's embarrassing. It triggers all of these like negative emotions, but it's not necessarily unsafe.
Right.
Depending on methods and intent and all of that stuff. But in this case, it wasn't necessarily unsafe. So, like, it's learning how to talk about it and not be scared.
Yeah.
Like, when are you self-harming? What, like, are you like, what's your routine?
Mm-hmm.
And, like, not being, like, scared to say, like I said a second ago, if someone wants to die, they're going to die.
Yep.
Like, it doesn't matter if you say, like, how do you harm yourself?
Yep.
Like, they probably want someone, no one's doing that, you know? Like, everyone's, like, scaring away or pathologizing everything or, like, and one of our producers said this earlier, you know, if, let's say, a teenager in high school is cutting and they want to talk about it, but they don't want to go to their counselor about it. Because if they go to their counselor about it, then they know that means they have to go to the hospital.
Right.
And if they go to the hospital, then that's a whole nother traumatic thing. Then they have to deal with their parents and meds and all. So I'm not telling anybody.
Yep.
So really, like, because of the stigma around it, kids aren't talking about it. And then it does have the potential to get worse, or like, shit, they could cut the wrong way and whoopsie poopsie, now I'm dead. I mean, not to, you know, trivialize.
Right.
But like, the foundational reasons of self-harm or what needs to be talked about. Like, you don't need, like, you cut, you burn, you bang your head. I don't care why.
Yeah.
And like, what's that rooted?
Yeah.
Like, oh, it's probably trauma. Oh, it's because your body goes into fight or flight. Oh, and so now this is like a habitual learned thing that makes you feel better and calms your nervous system down. Okay, so now we got to like figure that shit out.
Yep.
You know? Anyway, so, but the head banging, talk to me about that, or punching yourself. I've never heard about that.
I've had a lot of patients do that.
Really?
Yeah.
Is it like is it more like boy?
I would say if I had to like think back on the patients that I've had do it, and this is not based on like any kind of research, this is just what me saying.
Yeah.
I feel like I've had more boys do it.
Interesting. Like athletes? I don't know why I'm thinking athletes.
I don't know about athletes, but I feel like I've had more boys do it. But I've definitely seen it a lot. Like, I had a patient, I want to say it was like last week or the week before, who teenage boy, who said like and it's usually like out of frustration.
Yeah.
It's usually out of frustration, and there's not a whole lot of like thought going into it about like, because you know, when you see people who cut, like there tends to be a lot of
there's
like,
a routine.
Yes,
it's very
there's
routine.
There's like
planned.
a pretty elaborate thought process there, and with the headbanging, it tends to be like very like impulsive and just reactive, like super reactive. But like, either banging their head on a wall or punching themselves in the head.
I've seen like that, and like. But like on the wall, that hurts.
Yeah,
Shit.
yeah. I've had
like
a lot
you can
of
get like CTE from that.
Yeah.
Shit.
I think I actually had a patient. This was a long time ago. I had a patient who did end up having like concussion symptoms from banging his head too much. Yeah.
So like that. Okay. That behavior compared to like cutting, burning. Like, that just seems different.
It does. Yes, I agree. I do think it's different. I think it's very different because I think cutting and burning tends to be very methodical.
Yeah.
You know, like you said, there's a ritual associated.
And it's secretive.
Yep. And they usually are, they've usually like tried other things that haven't worked.
Like
or
what?
Quote unquote worked.
Yeah.
You
what
know?
do you, like, tell me what.
Like, I'm just trying to think of like other unhealthy coping skills
like
someone
sex
would do.
I don't know why that came
or
to
like,
mind.
you know, like, I don't know, like drinking or whatever. And they've like arrived at this, but it's not, I feel like it's less like random. You know, the headbanging tends to be kind of like reactive, random, impulsive, fast. But the cutting and burning is very methodical. And thought out.
Because like you can bang your head wherever.
Yeah.
I mean, you guess you can cut wherever, but you're not going to because of X, Y, and Z.
It's more, exactly.
And
more
like,
secretive.
not, what did you call it?
Non-suicidal self-injurious behavior. NSSIB.
It's too many words. Like, what, but like, how do you like this little piece of paper, okay? Put headbanging and whatever, what was it, punching.
Yeah.
In the same category as burning and skin cutting.
Right.
But it
Which,
shouldn't be.
No.
It doesn't sound like.
So I think part of the problem of providers not digging into this enough is probably time. Because it does take time to, like, you know, like when I have a patient who self-harms, like we dissect it. It's like, okay, I want you to tell me where this like physically, where are you when this happens? What happens right before? What's the thought process going into your head while it's happening? What are you using to do that? You know, where are you getting that thing from? Where on your body are you doing it? You know? And it takes time to like dissect that and to help the patient like walk themselves backward to like, okay, what happened right before? What happened right before that? What happened right before that? To figure out like what their triggers are. You know, that takes a lot of time.
Yeah.
And so like in a hospital, you know, like unfortunately, psychiatric hospitals nowadays are their sole focus is to make sure that someone is not suicidal, homicidal, or what we call gravely disabled. Okay. Which means that like, you know, they're not like actively psychotic or actively manic, okay, or like severely depressed to the point where they're not eating, okay? So once they ensure that those things are not happening, that patient's out of there, right?
It's like turning tables.
It's exactly, okay? And it's, I can tell you that like none of the psychiatrists want it to be that way.
No, right.
But this is how it has become because of like insurance and stuff, okay?
Yeah.
And so they don't have time, honestly, to dig into that, right? And unfortunately, a lot of these people who are like chronic habitual self-harmers will end up in the hospital constantly, like over and over and over again, okay? Because nobody knows what to do with it, right? Like if you go to the school counselor and you've got cuts all over, their like immediate reaction is like, oh God, I gotta get this kid to the hospital because what if they kill themselves and then I'm gonna get sued, right?
Yeah.
And so they're not gonna take the time to like sit down with that patient and like dissect exactly what's going on and figure out how to help them, right? So it's a lot of it's like it's a systemic problem. Yeah. You know? And so then these kids just are like in and out of the hospital constantly and never really addressing the real problem. Yeah. Right.
I mean, I just also think it's like a provider problem. I mean, I guess it's all intertwined, like systemized problem, provider problem. But like, let's say, like I feel like I may have had a student, whatever, who comes in and has like scars, and I do a suicide assessment, and like I like ask her all of those questions, and I determine that she is not at risk of suicide. Then like I would obviously consult with like my supervisor and the principal and whatever, but like I'm not, I don't know, like sending them to the hospital.
Yeah, well, I think a lot of like school counselors in particular, unfortunately, are well, I think that they've been like primed to react out of fear. You know, there's so much fear of litigation and something bad happening that a lot of times like they don't even want to touch it.
Yeah, they don't want to touch it.
They don't want to touch it because they don't want to be the one to mess up and say, oh, this kid's okay, send them home, and then they kill themselves, right?
Yeah, but and that's fine. Like I get it. But
I don't think
like,
it's okay.
I know, correct.
Like
no, I mean I get it. I know. I'm not like but like be confident. Like do your research. Look at the board's website. Look at the state laws. Look at all that shit, and like come up with an informed decision-making process. Yeah, like ethical process, and like that fear is like doing more harm than anything.
100%. Like I think school counselors need to be empowered to do more.
To do more. And it's like like they are minors. You call like how do you cover your ass? Call their parents.
Right.
Hey, your kid has scars. And also, they're scarred. So this has been going on for a while.
Right.
Why haven't you noticed? Like, you know what I mean?
Yeah.
It's like, I think everybody wants to blame everyone else about a kid's issue.
Yep.
Or whatever.
Yeah.
And it's like, I'm with your kid once a week for 50 minutes.
Right.
You're with your kid however many hours.
Yeah.
And you expect me to save your child.
Right.
that just does like mathematically doesn't make any sense.
No.
So you want to go to litigation? Let's go.
Right.
Not really. But anyway, so yeah, I just wanted to do a little, and obviously 13 Reasons Why like kind of triggered. It was like perfect storm with my caseload and watching this really depressing show. Just about like not normalizing. What am I trying to say? Like not letting the fear mitigate how you practice as it relates to clients who self-harm.
Right. And even like, I'll push it past that, even talking about suicidal thoughts.
Oh yeah, totally. 1,000%.
A lot of providers are terrified to talk about suicidal thoughts. If someone says they're suicidal, they knee jerk is like, go to the hospital, you know?
Correct.
Like I actually very rarely, infrequently send people to the hospital now.
Yeah.
Okay. Because I've learned that like, I mean, there's so much wrapped up in that.
Yeah.
You know, like you can lose a lot of trust with the patient, the rapport.
Oh, yes.
You
correct.
know, that you are subjecting them to a potentially traumatic experience. Not all the time, but it can be very traumatic.
Sure.
And like I do think there's an element of like, people then feel like they can't open up. You know?
Yeah, they can't trust you. They can't trust anyone.
And a lot of times, like, if you can, and obviously, like, I don't want, like, just lay people to be talking to their loved ones about suicide in this way. Like, this is, like, something that trained professionals should be doing, right? But, like, if you can really break it down with the person, a lot of times, like, I would say most of the time with my patients, they don't really want to die.
No.
You know?
No,
they
just
don't.
They're out like they're banging their head against the wall, pun intended. Sorry. Like they've tried everything, nothing works. This works. I don't know.
Yeah.
And this is like another little thing. And I don't know if I've talked to you about. I think I have. I don't know. I have a client who is like a young teen.
Yeah.
Has homicidal and suicidal thoughts.
Yeah.
Like pretty intense ones.
Yeah.
And like it's like fascinating. Like while they're having those thoughts can also rationalize that it's not true.
Yeah.
You know what I mean? Like I don't really want to do that. And I'm having these thoughts that are becoming really intense and frequent and high quantity, but I know I'm not going to do it. It's like this fight within their head.
Yeah.
And that's not like, that is different than like, ideation. Wait, it's ideation attempts. Is that it?
Suicidal ideation and attempts.
Yeah. Like ideation is like thinking about it.
Yeah.
Right? Yeah. So the way that that person presents is not like necessarily ideation.
Yeah. Well, and it's like, it's recognizing that like suicidal ideation is such a broad, like there's such a huge umbrella under that, you know, like it doesn't all look the same, you know?
Yeah.
Like there's so many variations and it's a very complex thing.
Yeah.
And it does take time to like piece that apart, you know, and figure out like what's actually going on in that person's brain.
Yeah.
What is the actual risk? Again, this is something
gauging
for
the risk.
mental health professionals to do. I will say that.
Yeah.
But yeah, I mean, I think it just boils down to like a lot of providers are afraid to talk about that. They're afraid to be the one to mess up and have like that one patient slip through the cracks. And unfortunately, a lot of times that dissuades people from talking about it.
Or accepting that client.
Right.
You know? And like this, whatever. I've had a couple of clients like this, and to me, and like, listen, this is like my professional opinion. It may not, someone else may be like, no, you know, that the thoughts were really intrusive, right? There was no control over them. They were most likely triggered by stress at home. Yeah. And like, they're just kind of manifesting in this like really wild way.
Yeah.
Now, does that mean that like it couldn't get more intense and maybe more real and now I can't control it?
Right.
Like this, to me, read more like OCD stuff. I mean, you know what I mean? Like this
that's
happens.
Something that I see a lot.
Yeah. Like having these, like, I don't want to do any of this stuff, but these crazy thoughts come in my head.
Yes.
Like that's different than being like, God, I'm like depressed.
Yes.
Like severe depression.
Yep.
Or bipolar.
Yes.
Right.
And a lot of those kids, like I've had several patients who the, quote unquote suicidal ideation is actually like an
OCD.
intrusive obsessive thought loop due to OCD.
Yes.
And they get sent to the hospital.
Yes.
Even though it's not the same.
It's not the same. And so like what I did was email both parents, not the best situation there, but emailed both parents with like a long narrative of how my recommendation is that this person get evaluated.
Yeah.
Because whatever I just said. And because like, I'm not going to be like, I can do my work, but I see this kid twice a month actually only.
Right.
And so like not saying like they need to be on a medication and get evaluated, see what the recommendations are. And like what could help this person. I mean, this is like a daily occurrence for this kid.
Yeah.
And like they can't live like that.
No.
Like this is terrible.
It's so distressing.
So distressing and like scary and whatever. And so like unless you want your kid just to be miserable every day,
right?
Like I would go get an eval and then follow the recommendations, whatever that eval is. Anyways, but yes, just wanted to like talk about this because I feel like no one talks about it, and it's
no
like
one
taboo.
talks about it, and it's like so much more complex than people realize.
Yeah.
It's so much more complex. Self-harm and suicidal ideation.
Yeah,
it's very complex, and it does not look the same for every person.
It does not, and like that doesn't mean that you can't like therapeutically confront it.
Right.
It just means like educate yourself.
Yeah,
and like check yourself. Like if something's triggering you when. Like if something is scaring you internally or triggering you or you're getting a judgment or you're projecting, like then you need to be like, okay, why? Why am I doing that?
Yeah.
And then figuring that out and putting it aside and dealing with that when you're not at the office and not letting that intrude into session.
Yeah.
Anyways, hope you enjoyed this really lighthearted episode.
Everyone feels uplifted now.
Yeah. Obviously, if you suspect or know or whatever, someone who is self-harming, suicidal risk, whatever, call, I don't know, like your mental health professionals in your community.
Yeah.
And stuff. But
get some help.
Get some help. That's the main.
Get some help.
Thing. All right. Goodbye.
Bye.
Thank you for tuning into this episode of the Little Brain Campaign podcast.
If you enjoyed our conversation, give us a follow on your favorite podcast platform so you never miss an episode.
And hey, those ratings and reviews, they actually matter, like a lot. Take 30 seconds to leave us a review while you're still thinking about it.
Until next time, remember, we're all just trying our best.
See you next week.